Hey, I'm Dr. Matt, and today what I want to talk about is a different approach to peripheral neuropathy. In other videos, I've talked to you about how the standard medical care for peripheral neuropathy only continues the progression in the wrong direction, and you're not addressing the root mechanisms that are actually going on. And so there's two things, if you've seen my other videos, that are happening with peripheral neuropathy. Now, peripheral neuropathy is damage to nerves, okay? Damage to the periphery of the nerves, particularly in the hands and in the feet, and working its way into the body, into the central area. So, with peripheral neuropathy, there's two things that are being affected. One is the blood vessels. The blood vessels supply the nerves with nutrients, and they take away waste. And then also the nerves are dying. Okay, so these are two things that are happening within the body that need to be addressed. So how does our treatment work to address these things? So let's go through that. So different approach to peripheral neuropathy is, one, we have to handle the blood vessel decay and degeneration. So one part of our treatment is with red light therapy. So some of you guys might know a small company known NASA. NASA developed, actually did a lot of research on the technology of near-infrared therapy for angiogenesis, regenerating tissues, decreasing healing time, decreasing pain, increasing or vasodilating blood vessels to get blood into the area. So NASA did a tremendous amount of research on this, because what was happening as astronauts were coming back into the Earth's atmosphere, they were blowing up a lot of their capillaries and blood vessels. So they needed a way to really help these astronauts heal faster, okay? So red light therapy was one of the therapies that they found to have a dramatic effect on the healing of blood vessels and stimulating a regenerative effect happening within those nerves. Now, with peripheral neuropathy, these nerves have also been misfiring for many, many years, many times, okay? And improper signals have been going through those nerves. So we use an electrical stimulation technology, much more than just your typical TENS unit, okay? But we use it's a stimulation technology at very, very high hertz to help to reprogram those nerves. And that's a simple way of saying it, essentially. So this can help decrease pain, can help to decrease inflammation in that area many times with people. And it's these two are very, very effective at starting this healing process and regenerating in the body. And so these address the blood vessels and the nerves right up front, okay? The third thing that we focus on and we look at and we use is something called the pulse wave, okay? I'm going to do a video on this so you guys learn more about this. This is a newer technology. We use this for many patients with tendinopathies, plantar fasciitis, knee pain, hip pain, back pain. I've used it on myself for tendinopathies, and what it is it puts auditory impulses into the tissue. These auditory impulses help to break up the capillary beds and the scar tissue, creating very micro cracking of these blood vessels. By doing this, it's supplying new blood for healing back to those areas. We found this very effective for our patients with neuropathy in their feet, as well as other tendinopathies within their body. Now, our fourth thing that we do in our treatment is regenerative medicine. So this really sets us apart from other offices because what we know today are stem cells have the ability to regenerate tissue. They have the ability to regenerate nerves, regenerate blood vessels, and they particularly stimulate the body to create for angiogenesis and for blood vessels to begin to regrow. Very important in the healing process of peripheral neuropathy. The fifth thing that we do is we work on changing your diet and reducing the inflammatory things that are creating inflammation within the body. So by reducing the systemic inflammation, you're going to improve blood flow, okay? Blood flow, as well as regeneration of the blood vessels and the nerves. Lastly, in the diet piece of it, there are some certain supplements that research has shown to stimulate those blood vessels and nerves to begin to regrow at a much faster rate. So our treatment is based upon getting to the root cause of the problem rather than just simply covering up in the brain, where it happens with many of the medications that are given for people with peripheral neuropathy. So if you learned something here today, if you have peripheral neuropathy or you know somebody that has peripheral neuropathy, please share this with them. If you have any questions or comments, comment below. We'll try to get to those questions as quickly as we can. And if you need help with peripheral neuropathy, we'd be more than happy to do our 16-point neuro exam on you to really give us a baseline of how much nerve function you've actually lost so that we can help you in this journey of healing up from peripheral neuropathy. Have a great afternoon, and we look forward to other videos that you can begin to engage in as well.